Welcome to the Ruddle Show. I'm Lisette, and this is my dad, Cliff Ruddle.
How you doing today?
Good. How about you?
Excellent. And it's been 1 month since we've been able to contact you, and here we are all together. So let's have a great show.
All right. Well, we thought we would start off today talking about math. So maybe you've wondered how much math you use in your daily dental practice, or maybe you haven't even wondered at all. Maybe you've heard a kid struggling in math. Maybe it's your own kid say something like, well, I don't need to know math because I want to become a dentist. Well, most dental schools do require some math for admission, and some even require statistics and calculus. So we were thinking about this the other day, and we sat down and we started brainstorming about all the ways we could think of that math is used in endodontics in particular, but also in dentistry. And we were surprised to find out it's used a lot more than we initially thought, right?
Well, absolutely. I mean, you probably, she already said it, but consciously or unconsciously, whether you know it or not, you're probably using a lot more than you think. Restorative dentist, that's basically the crowd out there. You're doing the golden proportions. And so whether you know it or not, you can look it up later, but the magic number is 1.6. So in art, in aesthetics, natural sciences, you find these things in nature that make beauty. You're using angles all the time. Implants, you're using XNav. Some of you are, and it gives you XYZ, but you are able to put that implant in precisely. We used to have bidirectional equal angles of reciprocation for shaping files. Now we have bidirectional unequal angles, and that's wave one gold as an example, where angles come in. We have measuring. You have a perioral department. The hygienists are measuring and probing the pockets. We get to working length, and we have to have a number. And we can either get it through measuring with a ruler, or we can use our digital radiographs and get it that way. CBCT, I'm looking at measurements all the time between the mandibular canal, the sinus, etc. Measurements, percentages. There's percentages of solutions. 5% sodium hypochlorite, could be 8, could be whatever you decide, right? CHX, 2%. Oh, EDTA, 70%. So we have percentages. We have percentages on files. We have fixed tapered files. We have regressive tapers, progressive tapers. We have to know all this stuff because it's part of the tools we use every day. Fractions, teeth can be broken up into thirds, roots, thirds, coronal, middle, and apical third. Crowns are about 10 millimeters. Roots are about 3, 4, 5, okay? Each third. So we can use math to take big problems and break them down to smaller problems. And by solving each small problem, we resolve the entire issue.
Yeah, even percentages. Like I remember when I first had my root canal, he was telling me, well, this, because I needed 2, and he was saying this tooth probably 80% will have a chance of success, and this one maybe 50%. So it turned out to be 100% though for me. So I'm happy about that. All right, so clearly you need some math knowledge for practicing clinical dentistry, but you also need math for just running your practice, setting your fees, balancing your budget, working with the insurance companies, even like knowing what a discount represents. And we've actually done a segment on this, and you might want to go back and check out that show because you might not really understand what you're giving away when you give like a 10% discount. So I guess if you go into inventing, you need even more math though, right?
Well, it depends on what you're inventing, but you probably will utilize some math, physics, chemistry like TCA, ATP, benzene triphosphate, engineering. There's all kinds, electrical engineering, there's mechanical engineering. So depending on the product, you're going to get into those worlds and you're going to learn more. Metallurgy, all the files are heat treated now. So there's pre-machining heat treatment, there's post-machine heat treatment, there's temperature ranges and all that. So yeah, you have to know quite a bit.
I've heard you talk about cross sections of files. I've heard you talk about torque values and what's the ideal one. So I mean, I know that it's
speed, torque, yeah, all that stuff.
I remember one endoactivator paper we did actually had a mathematical formula in it. I think you have that to show.
Oh, have it right here.
We were talking about sonic energy and amplitude and frequency and sine waves. So this was actually in our paper. So
that formula, it sounds crazy, but that is a prognosticator for cleaning a root canal system. So this is assuming you're using some kind of a sinusoidal wave. It's not a gentle wave idea. It's not a laser idea. This is more like if you're agitating with a polymer. So there are mathematical formulas that the team can look at and begin to use to try to improve your agitation.
Okay, so math is used, it's pretty intertwined with dentistry and endodontics, I think we found out. And we're going to do this segment again, this intersection segment, and we're going to pick a different topic next time. Maybe we'll pick social studies or history or art. I actually think this was really fun. I'm kind of nerdy like that, but this was a fun segment for me. I can't wait to do the next one.
God, I feel like I got a diploma. I take the tassel and I'm a mathematics man.
All right, well, we have a guest presentation today, so let's get to that. Have a guest presentation, and it is by Dr. Reid Pullen, who is an endodontist from Southern California. He is very passionate about endodontics and is fast becoming a leader in the field. Dr. Pullen is going to talk today about an innovative mechanical glide path file, the slider, which is part of the ProTaper Ultimate series and inspired by the concept of Rotary First. And the title of Dr. Pullen's lecture is The Super Slider Rotary Negotiation, a New Paradigm in Endodontics. But before we get to it, why don't you first tell us how you know Dr. Pullen and the circumstances surrounding why we're showing this presentation today. I think it involves some deal you made with him.
Well, probably first, he was one of those people that says, I know Cliff Ruddle, and Cliff Ruddle's never seen him or met him because I saw him in an audience, and I think he alluded to this, Will alluded to it in his lecture. He was a face in the crowd for me, but that's when he first met me. I first met him when he came to Santa Barbara, and he came, Phyllis, started this Ruddle with the residents, and he came up with Jim Simon was replaced by Steve Davis. So Steve Davis was his mentor at the Long Beach VA. He brought his group up with some other colleagues, and I met Reid there, and I thought immediately he stood out among residents. So I won't tell you why, but I've learned to do that in the years. So that was kind of our interactions. And then, of course, as he grew early in his career, he was very good. So he became an opinion leader for Dentsply Sirona. And I started seeing him at meetings, and I saw him present. And just through that, I loved his passion. He was pretty excited. And then we would have ongoing discussions. I mean, as an example, he came to Santa Barbara and drove up here, and we've had lunch together and stuff. But I made a deal with him because he's an opinion leader. So he wanted to know all about ProTaper Ultimate. So I baptized him in Ultimate, but I wanted him to have his own discovery. So I said, Reid, if you can do 500 canals with ProTaper Ultimate Slider, it's a new file, I'd like you to come on the show and tell your experiences. He said, well, what if I don't like it? I said, I'd like you to come on the show and tell your experiences. And what if I break a lot? I'd like you to come on the show, Reid, and tell your experiences. So I don't know what's going to happen. You don't know what's going to happen, but would you do that? He said, I'd be thrilled. I said, okay. I didn't talk to Reid for months, And all of a sudden I said, Reid, would you like to be on the show this season? And he said, Ruddle, I'm at 1169. So he's done 1,169 canals and he has stuff to report. So I'm pretty excited about that. I know he's really excited that he got to be a diplomat, and I just want to toss that out because that's a milestone, a diplomat of endodontics, a diplomat. And then, of course, he started his practice from scratch, and that's not so normal in these days. Now, he has practiced for quite a few years now, but still, even then, it was usually an associateship, partnership, something like that. So those are the things that I would say the most. And then on a personal level, this is what really connected. You played baseball, I played baseball. You played basketball, I played basketball. I didn't really play football, flag. He played tackle. He was a college football player, Cal Davis. Okay, UC Cal Davis. And then, of course, he was a coach. He coached all those sports. Plus, he coached his kids' soccer. He coached all of his kids in that, 3 kids. And then as he got older and he got tired and he got wore out, and he couldn't jump anymore. He couldn't block those tackles anymore. You know, he couldn't hit the ball quite as far as he'd like to hit it, and he was missing a little bit. He went into the easier sports like jujitsu and golf and surfing.
I think he's a black belt in jujitsu, right? I think it took him 12 years to.
12-year journey. So anyway, you can begin to see as the audience out there, Reid's not just a typical, well, maybe he is a typical dentist in that a lot of dentists have very unusual proclivities for things you might not always think. But I refer all my golf out.
All right. Well, just to tell you a little bit about Dr. Pullen professionally, he graduated from USC Dental School in 1999 and served 3 years in the Army Dental Corps in Landstuhl, Germany. After returning to the U.S. and being in private practice for a couple years, he decided to become an endodontist. And then he graduated from the Long Beach VA endodontic residency program in 2006, started a private practice limited to endodontics in Brea, California. And then, as you mentioned, he went on to become a diplomat of the American Board of Endodontics in 2013.
Yeah.
So he's also founder of rootcanalacademy.com and the 2-day root camp boot camp course. So you might want to check that out. So that said, we are very honored to have the opportunity to show you this presentation. Let's see it.
Hello, everyone. My name is Reid Pullen. I am an endodontist in Southern California, and I've been an endodontist for 18 years in clinical practice. Called Brea Endodontics. I would like to say it is a huge honor to be on the Ruddle Show. Cliff, thanks for inviting me. I want to say that I was a general dentist for 5 years, 3 years in the military, and then 2 years in private practice. And I had an inkling that I wanted to be an endodontist. And so I came to this lecture in Anaheim at Disneyland by this famous endodontist named Cliff Ruddle. And I watched him lecture for the day, and that was it. After I heard Cliff speak, I said, I'm going to be an endodontist. I was set, and I am so grateful for that lecture and for your mentorship, even as a general dentist through your lecturing. And then as I became an endodontist, you mentored me throughout those times, and you've helped me become a better person and a better endodontist. So thank you so much for that. And let's get into the presentation. I want to talk today about something I call it the super slider or the sexy slider. And this is a new paradigm in endodontics because this file will make you so efficient, so effective, and help you get an excellent result. So we're going to talk specifically about one NiTi file called the slider. Now, this comes from the ProTaper Ultimate instrument family. Okay, and this is the slider. This is what we're going to focus on. The ProTaper Ultimate is a kind of a new instrument system that is the evolution of ProTaper Gold. So they basically, Cliff Ruddle, John West, Pierre Mastu, as you know from the Ruddle Show, they took ProTaper Gold and they made it a little bit smaller from 1.2 millimeter diameter to 1 millimeter diameter, and they wanted to focus on a minimally invasive type shape. And so that's how the ProTaper Ultimate family came into existence. But they created this slider. And I want to talk about the slider because it is really an exciting file. Here it is, the Super Slider. And it's something we call a rotary negotiator. And this is kind of a new concept in endo. Uh, we were always taught as students in dental school, and even as we got out, and even in the residencies, endo residencies, you always use a hand file to negotiate down the canal. Well, in this file system, ProTaper Ultimate, the slider is actually replaces the hand file. Okay, most of the time. I'll talk about that. You can use the slider as your rotary negotiator, and it'll advance down the canal to working length or through the apical minor constriction to patency. And you can actually negotiate to patency and get a working length and a glide path in just seconds, okay? Now, the cool thing with the slider is I use a slider with any file system that I use. I start with the slider, okay? So obviously ProTaper Ultimate's a great system. I'll use ProTaper Ultimate. I also love ProTaper Gold and Wave 1 Gold. But any of those file systems that I'm using, I will start with the slider and I will use that as my rotary negotiator. Okay, so here is just kind of a look at the ProTaper Ultimate, and specifically the slider, which is made of M-wire, so it's a little more resistant to cyclic fatigue. It's a heat-treated file system. And when you look at the dimensions of the slider, you can see it's got a 16 tip size. Okay, so that's perfect. Basically, a glide path is when you at least get a 15 hand file down to working length. And that's kind of our goal to get an open glide path. This satisfies that by having a 16 size tip and a 2% taper at the tip. You want to run this at 400 RPMs and 4 to 5.2 Newton centimeters torque, okay? A little bit different than the 300 RPMs that you run ProTaper Gold, or 500 RPMs if you're using Vortex Blue. This is 400 RPMs, and you're using the 4 to 5.2 Newton centimeters on the torque, okay? You're going to use very light pressure, especially with the slider. Remember, you're asking this to negotiate down the canal where no file has been before. So this is a file that's advancing. You want to use very passive hands when you're using the slider, okay? I find the canals first, right? Easier said than done on some cases, right? Find all the canals, and I always start with a coronal negotiation with a 10C shorty. In fact, this is, I think, the tip of the day right here. Every time you find a canal, always explore that coronal third with a 10C 21 millimeter file. The C file is a little stiffer than a K file. The 21 millimeter file is shorter than a 25. Dip it into RC Prep and get in there and explore each canal and just make sure that it's open in the coronal third. Make sure that there's not any calcification or that a pulp stone fell into one of the canals. Just make sure it's nice and open, nice and smooth, about 10 or so millimeters down. Then you could go in with your super slider and you can start to do your rotary negotiation, okay? So I always start with my 10C shorty, make sure I've got a nice open canal in the coronal third. Then I go in with my slider, okay? I say it's the first file in, I mean it's the first rotary file in the canal, and this is really the workhorse, okay? Now, what do I mean by that? I'm gonna explain, I'm gonna show you why I call this file the workhorse. All right, so remember, we're using this file instead of a 10K hand file or C file to negotiate to patency, okay? To negotiate down to working length. So before they put this file out, they wanted to test it. And so Dentsply Sirona sent this file system out to a bunch of endodontists. They tested it. They came up with 63% of the time, this group of endodontists were able to get down to working length, down to the apex with the slider without using hand files. 63% of the time, okay? So I wanted to do my own little test because when I started using it, I was getting pretty good results. So I wanted to see if that number held true or was it lower or higher, but I was getting pretty good results. So I went ahead and started testing this. I've been testing this for over a year. I'm at 1,169 canals, okay? And I am at an 80.5% success rate. Okay, this is pretty killer, okay, because as an endodontist, I'm treating some very difficult cases. 80.5% of the time, I can get this slider to reach working length without the use of a hand file within 1 to 3 passes. Okay, sometimes the first pass, it won't advance down to working length. It might take 2 passes or 3 passes, but a lot of times I'm able to get 80.5% of the time, get down to working length without the use of a hand file. And this is brilliant when I do this. It makes the treatment so fast. Okay, this is where I reach the apex passively. Now, what are the benefits? Okay, why is this the workhorse, and what are the benefits of using the super slider? Okay, well, step one, 80.5% of the time, you're able to negotiate to patency efficiently and effortlessly. It just slides right down the canal to the end, pops out the minor constriction, and you can then get an accurate working length by hooking up your apex locator right to the slider. You can slide to the slider shank or to the handle. Doesn't matter. You can get a nice accurate reading. Third, it'll cut a nice open glide path. Okay, so you'll be able to negotiate a patency, achieve an accurate working length, and achieve an open glide path in seconds. Sometimes on a simple to medium difficult case, I can do this in 3 canals in less than 30 seconds. And it just makes your life easy. It's simple because you're able to get a nice quick working length, cut an open glide path, and you negotiate it down, you get a nice working length, and you cut an open glide path. And then you're ready to shape. And the shaping then is easy. The hard part is all the stuff before the shaping, finding the canals and then getting down the canals. That's the hard part. So if you can do this, if you can find a file that can help, push you to be better and to do this faster and safely, then that's the bonus. And that's where the super slider comes in. Okay. So what about this 20% of the time? I'm successful 80.5%. What about 20%? What happens then? Okay. So sometimes you put the slider in and it's hitting a brick wall. It just won't go around. It's usually a little apical curve. It just won't go around that apical curve. And you go, bam, you feel it hitting the brick wall, hitting the brick. Once you do this, just forget it. Take it out, take the slider out, take a deep breath, and go traditional. Negotiate to patency with either an 8 or a 10K file. What I typically do is I'll put a little 45-degree apical curve or bend on the end of that 8 or 10K file, dip it into RC Prep, and I'll go in there and I will take it on a walk around the apex. I'll take it on a walk around trying to find where that little curve is, that apical curve. And so no big deal. It doesn't work 20% of the time. You just do a traditional hand file. You get working, you get patency, then you get working length, then you'll do a glide path, an open glide path. Okay, here we go. So that's what happens 20% of the time. Now, what about the dark side? The dark side of using rotary negotiation, that would be file separation. Okay, so it can happen if you're rough with this. You can separate. Now, I've separated, you saw how many canals I did, over 1,000 canals, over 1,100 canals. I've separated 3 times. Okay, 2 of them were early and 1 was recent. Okay, I was being a little bit rough. All 3 of them I was being rough. 2 of them I was able to bypass. 1 of them I got stuck. It was stuck at the end. Done. Okay, no big deal. A lot of times those will still work. It's not pretty. We don't want that, but it's very rare. And if you use passive hands, which I'm going to show you right now, you can prevent this. Okay, if you feel like the slider's hitting a brick wall, you stop, you pull it out, and you go traditional hand files to negotiate the patency. Okay, so here's the feel. You almost hold the file. It's passive. It's just a passive feel. You're not pushing on the file. You're letting the file kind of just lead you in there, lead you down the canal. So you hold it with very light pressure. You always dip the tip of the slider with RC Prep or Pro Lube. Okay, this is the only NiTi file that I dip. I don't dip my files. I'm not a dipper. Okay, I only dip the slider with RC Prep because I'm asking it to negotiate down to patency where no file has been before. Okay, so it has to kind of rip through that tissue. I want a little bit of lube in there to help it do that so it doesn't get caught up. The key is when you're using the slider, don't be a construction worker. Don't hammer this slider into the canal when it's not going. If you're hitting a brick wall, don't hammer it like a nail. I want you to do your Zen endo. Take a deep breath, breathe through your nose, and very light pressure with this baby. And use your Zen endo when you're using the slider. If it's not advancing to working length, then get out, and use hand files, okay? But again, 80% of the time, it's gonna go down to working length within 1 to 3 passes. So it's really a beautiful, beautiful thing. Here's the slider dipped with RC Prep. I got the dip the tip in there, okay? Use your file lubricant. You can use Glide or ProLube or whatever you want. Doesn't matter. Just use file lubricant. And now I'm going to show you a video of a mesial buccal canal of an upper molar. Hard to get in there to get that into the MB canal because I don't have a coronal flare yet. I don't do a coronal flare when I use this. I'm going to do the MB canal. I'm going to put a little teeny bend on it. See, just enough. Dip it into RC Prep. Okay, and then have the patient open a little bigger. Okay, tooth number 3, and there it goes. Right there we go. Got in there, and now I can run it and see if it'll run down to my estimated working length. Okay, so let's watch this now. Here we go. Now I'm running it. I'm nice, easy, engage, disengage, nice and smooth. Passive hands. I got down to my estimated working length. Hook up the apex locator. Look, I'm long. Perfect, right there. Push the stopper down. Get your working length. That's excellent right there. I just negotiated patency, obtained an accurate working length at 19.5 millimeters, and I cut an open glide path in the MB canal of number 3 in seconds. Boom. I just took away 3 big pillars of endodontics. 3 big pillars of endodontics in seconds, okay? Negotiated patency, accurate working length, and an open glide path. Okay, so this is beautiful. I would wipe the file. I would just go right into the DB canal. So I do it sequentially. MB canal, get my working length, go to the DB canal, then I go to the palatal canal. So I do it one after the other. And in some cases, under a minute, I've got 3 working lengths, 3 glide paths that are open, ready to shape. The shaping's easy. The shaping's the easy part now, okay? The finding the canals, getting down the canals is the hard part, right? So there we go. That was our working length. Let's look at a case. This is tooth number 16 or number 28 if you're international. Tooth 16, very difficult case to treat. It's a wisdom tooth. It's infected. Let's take a look at the CBCT. Okay, so here's our cone beam. You can see the palatal canal in the MB1. You can kind of see an MB2 in there vaguely. That's the coronal view right there, the coronal view. Here's sagittal view. You can see the palatal root. You can see there is a mucositis of odontogenic origin because we have a periapical radiolucency on all 3 roots, really. Palatal root, mesiobuccal root, it shows here. But then you look at the axial view and you can see that unfortunately there's 4 canals in this thing. MB1, you can see the MB2, you can see the DB, and you can see the palatal. So I said, shoot, this was an older individual, number 16, 4 canals infected. I go, dang it, I had some anxiety before I treated this case. But what happened, what I found was the slider and the ProTaper Ultimate system made it so easy and so fast to treat this that I walked out of there just in awe at how simple it was to treat. So I'm going to show you the MB canal, just showing you how I was able to get working length on this case, okay?
Okay, we're gonna use slider.
There's my slider. Dip it into RC Prep or Glide or whatever you want. Get some lube in there. Let's go to the MB canal.
Let's go in. Open big for me, Willard.
Now,
Good.
passive hands,
All right,
in and out.
open here.
engage, disengage. Mini in and outs, nice and gentle, nice and smooth.
Okay, let's look that up.
There we go. That slider went right down to working length.
Let's hook this bad boy up.
Just hook it right to the handle. That's your apex locator. Boom, got it. I was able to get working length. I was then able to get working length on all 3 of these canals. Okay, and then I later found the MB2, had to work that one up too. I went up to a ProTaper Ultimate F2, but the slider advanced to patency in all 3 canals, and it took me about a minute to get down each canal to get a working length that cut an open glide path. So it was pretty cool. I basically, yeah, did this, finished this in a minute, and I was extremely happy with the result. Nice shape, nice clean out, and I took a post-op CBCT just because I wanted to take a look at it. This is the coronal view here, and you can see the palatal root was perfect. The MB1's good. The MB2 was a little short on the fill, which I was slightly disappointed with myself. But let's just, we won't go crazy on that. Here's the axial view. You can see how beautifully, how this minimally invasive file system ProTaper Ultimate cut these beautiful smaller shapes, and they stayed centered right in those roots. So a really nice shape there. On the MB2, I went to an F1, so I used a real small shape on that on the MB2. So that's that. That's the case. Now, last thing I want to talk about is I've been using the slider, and I use it with ProTaper Ultimate, or I'll use it with ProTaper Gold, or I'll use it with Wave 1 Gold too. So I kind of hybridize it sometimes. The slider is such a valuable file because I'm able to negotiate to working length passively without the use of a hand file 80% of the time. So why not use it for every case that you do, even if you're not going to use the Ultimate system, which is a great system. But I've been doing this slider gold technique, or I call it the fab technique, because it's just fast and beautiful. It's such a great technique. It's a hybridized technique. I hesitated to talk about this but it's because it can be a little confusing, but it's just a hybridized technique where I start with the slider, I do my rotary negotiation, get my working length, get an open glide path. Then what I do is I go to the ProTaper Gold Shaper 1. I leave it on the same RPMs, 400 RPMs, and I cut my middle flare. So I just run the ProTaper Gold Shaper 1 2 working length that cuts a middle flare. Then what I'll do is I will finish the apical third with the Wave 1 Gold primary. And that's that reciprocating file that reciprocates. And I will plus it if you need to. This is just shape larger. If you need to go a little bit larger, Wave 1 Gold medium, or you could cut with an F3, ProTaper Gold F3. If it's a palatal root or a distal root that's bigger, do that. But most of the time I'm finishing with the Wave 1 Gold primary. The reason this technique is so awesome is because it is so fast, okay? The rotary negotiation using the slider, like I already said, on these simple to medium difficult cases, it takes less than a minute to get this slider down to working length and to get your working length and glide path. The ProTaper Gold S1 or Shaper 1 is one of my favorite files in the world. It's the slider and the ProTaper Gold S1 are my 2 favorite files. I just love those. It just cuts a beautiful balanced middle flare. I mean, it just opens that middle third of the canal, and it gets it ready so you can just finish the apex. So I have probably shaped 10 to 15,000 cases with ProTaper Gold. I just love that system. I love Wave 1 Gold Wave 1 Gold system, and I love the ProTaper Ultimate system too for the smaller cases. Then I come in and I quickly will shape the apical third using the Wave 1 Gold primary, which is a reciprocation. So you just have to change the setting one time, and it's crazy. This fab technique, the fast and beautiful, it gives you these fast and beautiful shapes. I call it also fast as Bolt, FAB, fast as Bolt. Usain Bolt, who has the world record in the 100 meter and 200 meter races in the Olympics. I mean, it's that fast. It's so fast. You can just cut these shapes. And I want to show you an example. One, here's tooth number 15 or number 27 in international speak. And you can see the curves on this mesial buccal root. It's got some curves. You can see the working length about 21, estimated working length about 21. I was able to use the slider gold or the fab technique. I used my slider, my ProTaper Gold S1, and I followed up with the Wave 1 Gold primary. I shaped this case in like a couple minutes. And it was incredible. And I got a really nice, beautiful result. Fast and beautiful, right? And it's just a very fast technique, very cool technique. It gives you cut and you can shape your canals fast, very efficiently. It gives you plenty of time for a activated irrigation. Okay, when you activate your irrigant, your sodium hypochlorite and your Q mix or your EDTA, you then get an enhanced disinfection. And the easiest way to do this is by using the endo activator. Okay, the original endo activator on the left ran at 10,000 cycles per minute. The new endo activator runs almost twice as strong, 18,000 cycles per minute, and it is sonic activation at its finest. This is just a simple device to use to get a really clean canal. There's lasers out there. The Lightwalker laser is a good using sweeps technique, but they're expensive. So some dentists don't want to spend 100 grand on a laser. You've got this endo activator, especially this new one, 18,000 cycles per minute. You can get some beautiful cases with this. So if you can shape those canals fast, then you have plenty of time for enhanced disinfection and to get the cleanest canals possible. And boom, boom, you got it. Okay. Love for you to shameless plug for rootcanalacademy.com. Please go on the website. I've got lots of great instructional books, and they're fun. I have a great time with these books that really help you to be a better dentist when you're doing root canal therapy. Okay, so please go see rootcanalacademy.com right there, and love to see you, love to chat with you. And my favorite book is this Wave 1 Gold. This book, I've got 6 full cases. You get a QR code. Under the microscope, you can watch my full cases where I narrated them and a step-by-step guide of how to do an endo from start to finish. It's one of my favorites, and it's a surfing theme, so lots of surfing in there too, pictures of my family surfing. Okay, and then anyone interested in a 2-day root camp boot camp, please go see rootcanalacademy.com. These are the dates coming up for this year. Would love to see you. It's a 2-day course, wonderful course. I do a live patient demo, upper molar, and you can see that real clear. So thank you so much. If you guys, I'm really grateful to be able to share with you, and I hope I helped you. Always wanting to help you guys get better. If you need to get a hold of me, there is my email. Okay. Thank you so much. You guys have a wonderful day. Thank you.
Okay, that was an engaging presentation, very clear, great visuals, and I really liked that I felt like we were getting to know not only Reid Pullen, the clinician, but also Reid Pullen, the person as well.
Oh, yeah.
He seems very friendly, honest, and open, and I really thought he did a good job talking about the benefits of the slider and how to use it more like a Zen master, less like a construction worker. That was my takeaway. I thought that was funny, but his humor was great. It makes him feel very approachable, and I imagine having a good sense of humor is a great quality to have as a teacher.
A great sense of humor is a great quality to have for any person in this world on the planet now.
True. What do you think of the presentation?
Reid, you really hit a home run for me, pal. You made it clear, it was concise, it was reproducible. The 3 tenets he stressed that I'm not going to say more than a word each is he really wanted to talk about working length. He wanted to talk about, geez, I gotta look down here. His patency, I think of it a little bit different in a different order, but working length, then he wanted patency, and then he wanted you to have a glide path, a smooth, reproducible glide path. That was the 3 things. So he showed us how to do that, and that was even more remarkable. And I'm going to add something that he didn't say, and it's not in our script, but there's all this buzz lately on the forum about, you got 2%, 4%, 6%. Well, now you can get something in between, like a mini cut of 3 at 5. He talks about how all those percents from 2% to 8% are on one single file. So I thought that made it simple. And then I liked, you mentioned he's happy spirit. He's a good guy. He's got a great sense of humor. He ties his world into the endo, so it's relatable. But beyond all that, I want to talk a little bit about his success of 80%. It's actually, Reid, 80.5%. I'm going to say 80. Because when we sent these out, when Dentsply Toronto sent out the sliders, and they sent them out to the international opinion leaders, there was maybe 60 testers, and they had the files for like 30 days, maybe 45 days, and they had to fill out big reports, send them back. The company did all the analysis, and they found out that these dentists were able to get to link to Rotary First, no hand files, 63% of the time. Well, Pierre and I and John had thought it was 80% a long time ago, but you and I talked about why might that be? Well, if I'm an opinion leader and I get some files and I find cases and I start to use them, whether it's extracted teeth or patients of record, I'm going to try them for about 30 days and then I'm going to fill out my report. And I'm not necessarily using them on every case. So I think the difference was by the time you get to 1,169 canals, you're doing a lot more than the people that had a chance to do maybe 30, 40, 50 canals. So I would say a big one was experience. But there was several little additional things. And I don't have it. I have something here, but a few little tricks of the trade. He showed how he cradles the handpiece and the webbing between his thumb and his index finger. He's not up here with his finger going back, 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 back. So he's letting the file run, progress, advance. He's taking multiple passes. If it starts to bog down, he's removing the file.
I heard him say 1 to 3 passes.
1 to 3 passes. So you don't take the whole apple at once. You take it in bites, and he's learned that, and he's teaching that. So I think the way he held his handpiece, the way he's very passive and easy and lets the file tell him what to do. If the file is bogging down, he takes it out. And he even talked about the 20% when he can't, and I won't go into all that, but I like, because it's not going to always get the length, the big 3. So he talked about ways he then catheterizes and reaches length and patency. So I liked all that. So I think his experience, the number of cases he got to do with the way he holds the handpiece and his passive technique, and be willing to try. You know, your people like Reid, they're willing to get in there and try and fail. They're willing to try.
We saw at the end of his presentation when he had a picture with his course attendees, they had books like this, and we actually got a copy of the book.
Thanks,
here.
Reid.
And you can see that there's like it's so beautiful. There's so many big pictures.
So I don't know how to do this on camera, but everything is pictures and words and pictures and words. And if I was able to, anyway, if you look at the back of it, he has 9 books, not 1 book.
Yes.
I wrote the preface for one of them, so you should just buy that one just so you can read what Ruddle said about it.
Okay, well, I have a question for you, and maybe some of our viewers might have the same question. So the slider is a Rotary First mechanical glide path file, and it is part of the ProTaper Ultimate series. I'm getting to the question. And then the Pro Glider is also a mechanical glide path file with the same D0 diameter as the slider. So why is the slider Rotary First, but the Pro Glider requires you to first negotiate with the 10 file?
Because I said so. No, people ask that. That's a great question. You know, from the ProTaper Gold family, we have the Pro Glider, and from the Ultimate family, ProTaper Ultimate, we have the slider. The difference is the slider has a different cross section. That's probably 90% of it. It is a changing parallelogram. It's a rhomboidal cross section, and it changes over the active portion. It's balanced beautifully. We alternating offset machining was also employed. That's a patented technique. It was on some other of our shaping files, but it was never on a glide path file. And the metallurgy is still M-wire. It's 400% more resistance to cyclic fatigue. It's a little stiffer than the other heat treatments where they get too flexible and they can bend over and they can unwind. So dentists don't need to always want more flexible. No, sometimes you need more rigidity. So I would say changing the M-wire a little bit, the cross section, which was significant because ProGlider is a convex triangular cross section. So it's a different cross section. That's why it has safety and efficiency. And that's why about 80% of the time, when you find the orifice, you take the file and in you go. And in 1, 2, or 3 passes, you reach length. No hand files. That's revolutionary. Now, a lot of other people are copying it. They're changing angles and nomenclature to say we can do it too. Can you do 80.5?
Okay. All right. Well, I think I understand a little better now. Moving on. I really like that he was open about his 3 file separations. He said he was going to talk about the dark side, and then he threw a bunch of light on it and owned it. And I just thought that was kind of cool that he talked about that. What do you have any comments about it?
Well, I'm going to use some math. Didn't we just talk about math? He said he had 3 breakages. 2 happened quite early in the journey, and he attributed those to roughhousing. And then he said he had one recently, and he attributed that to maybe being a little bit of a hurry.
All right.
Another-
Did he say he was aggressive? I thought maybe
He
he
said
said
he was a little
aggressive.
too aggressive. He thought maybe he was, jujitsu.
I was thinking his
chopping
martial
blocks.
arts training influenced that.
Well, you saw in his movie he did have a hammer. I mean, you don't know. Reid might be maybe he put his hammer away. But anyway, 3 breakages. Let's get back to math. That is turning out to be 99.7% success. Would you like to join Ruddle in any endeavor in life? And I could say, Ruddle says you'll have success about 99% of the time. That means the reciprocal, breakthrough was 0.3%. So that's an astonishing small number of breakages. And the main thing is, if you don't know why those 3 break, it's still a little bit of a dilemma for me. But if you can understand exactly why your files broke, then like the hand, turn the breakdown into a breakthrough. And that's what he did. He identified why it happened.
I do remember the kids' coaches in sports saying that sometimes a loss is better than a win because you learn more from a loss.
Well, there's a lot of truth in that.
All right.
If you accurately discern the cause of failure.
All right. Well, Dr. Pullen also spoke of his silver gold technique, aka the fab technique, fast as beautiful, fast as bolt. And in that, it's a hybridization of the Ultimate Slider, the ProTaper Gold S1, and then the Wave 1 Gold Primary. And I know you're not big on hybridization, and I think he might even mention that. But so tell us how you feel about his technique, though.
I'm not a big hybrid guy because I'm going to give you a few analogies and just bear with me. I'll try another camera. This one's getting very old. Reid played basketball. I imagine when he played basketball and it was competition, was the rim always the same diameter? Was the ball, like the NBA ball, the WNBA ball, they're not the same diameters. So you usually show up and there's familiarity. When you play tennis and you hold a racket, there's the weight of the racket, there's the grip, there's the size of the head, there's the string material, there's the tension on the strings. Do you have a different racket, different head, different size every time you step on the court? When you play what? Golf. I don't golf. He golfs. I saw golf, jiu-jitsu, right? And surfing. Does he use different clubs every time he drives the ball, or has he got his clubs, kind of figured out, and he's got the clubs he carries, the ones that he needs, not different clubs from different companies on every single time he plays around. And finally, I guess in baseball, which I played a lot of, I had my bat. It was a certain length. The handle was a certain size. The barrel was a certain size. It had so many ounces. And you don't change bats every time you go to the plate. So that's my complaint with dentists. They're always hybridizing because sometimes you can get off in the weeds when you try to mix and match. But in this case, I thought it was brilliant. Reid, I thought it was brilliant. You know why? Because I don't want to brag or be overconfident here, but everything he did was Ruddle endodontics. He did what? The big 3. He catheterized the canal with a mechanical file 80% of the time. He got working length, and he got paid seat glide path. Okay, got that. And then he used the S1 from ProTaper Gold. He opened up the body. Ruddle calls that pre-enlargement. That's why we built the file that way. So I built that file with my team, and he's using that exactly to open it up. Once he has the upper 2/3 open up, oh God, we're using more math, growing 1/3, middle 1/3, 3, 4, 5, 3, 4, 5. All right. Then he grabbed the the primary Wave 1 Gold reciprocation to do the deep shape. It's got 7%. So it's a tip of 2507. And so our teams built those files. So he's taking files that we built because we never saw these files, Lisa, as a file to cut a hole in a tooth. We thought the files were to embrace the philosophy of treatment. And the philosophy of treatment is to have a shape that's root appropriate, to have a shape that can exchange irrigant into the uninstrumentable portions of the canal. And then we wanted a way that we could fill root canal systems. So everything he did was in the spirit of Ruddle endodontics.
And I thought I heard you also say too that using the reciprocation in the apex or the apical 1/3 might be actually a little more safe.
It's been shown that I'm not going to do a lit review, but a lot of papers have shown the absolute safety of a reciprocation mesh, because that engaging angle of 150 degrees is always under the elastic limit of the file, and then it disengages.
Okay, now I don't want to embarrass you, but I'm going to. So in his presentation, Reid, Dr. Pullen, said a lot of very nice things about you, and he even credited you for sealing the deal on his decision to become an endodontist when he heard you lecture. And then he also says that he thanks you for your mentorship and helping him become not only a better clinician, but a better person as well. So I thought I would take a moment now to talk a little bit about legacy. And I mentioned in the first show of this season that legacy would be an ongoing theme throughout the season on our road to 100. And legacy is basically the impact you have on other people, how they think, what they do, what they say as a result of having met you and known you. So how does it feel to learn the impact that you've had on Dr. Pullen and countless others for that matter? Because I've seen many emails and stuff where doctors have said that they thank you so much, you've changed their lives. Literally, that's what they say, change their lives. So how does it feel to have this impact on others?
Well, I guess accidents happen. Remember, David Landwehr said anything can happen to anyone at any time. So accidents do happen. No, you don't start your career, and Reid's, I don't know, Reid and I have never talked about legacy. I should, because I'm going to stop. If you really want to work on legacy, go back to the show we did on Path of the Heart. It was an obituary. So go way out in the future and write your obituary. And when you write your obituary, you've now, oh, geez, I'm still alive. That's great. So now you have a roadmap. So you don't really think of it like that. I thought about the roadmap and all that, but I'm not thinking about everybody else. So there's an old Asian expression: before enlightenment, chop wood and carry water. And after enlightenment, chop wood and carry water. So you stay humble. You keep working tirelessly, endless repetitions. Remember the plateau. I've talked about that endlessly. Most of life is in the plateau. And then every now and then you buy a book and whoa, there's a big gem right there. Boom, you jump up, and now endless repetitions, months can go by, and then you take a class and then you get another bump. So you're always working. And if you stay working, if you're kind and you're humble and you're engaging like Reid is, people want to be around success. There's an old clue: model success. Success leaves clues.
You said you made, you went to that class and you wrote the obituary, how you wanted to be remembered. And so you kind of had a general framework in mind, but I don't think every day you were thinking, I'm doing this for my legacy, for the legacy every day. No, it just was, like you said, chop wood, carry water, before enlightenment, after enlightenment, chop wood, carry water. You just worked every day, did your best.
Well, then I'll throw it right back at you. So you woke up one morning and said, gee, where can I go buy a black belt?
No.
No, you earn it. And I made a little note here that I don't know that leaders are born. I don't know. We'd have to have a big talk about it. There would certainly be traits and characteristics and genetic that might prognosticate that, but leaders are developed. So you're a leader of your office, okay? So you start, if you want a legacy, you start by, what do you want your staff to say about you when, the tombstone out there or the little urn, here lies my boss, he's the greatest guy ever worked. Okay, well, if you want that to happen, then treat your staff so you can meet the destination. So I think you just work hard. You lead by example. You lead your patients. You lead your referrals. If you're an endodontist, you lead your staff. And good things can happen if you keep working. You have passion, determination, and desire, and you just keep at it. And then if you want to teach and stuff, you're going to start having an impact. You'll get immediate feedback. When you see the door swinging at 10 or 11 in the morning, that seat left, that whole row left. Or are they there at 4:30 in the afternoon on the edge of their seats because they just can't get enough? So you got to learn to keep people engaged. They'll never remember what you say, but they'll always remember how you made them feel.
Okay, I know just from watching you that I have seen that you're a very hard worker and you work hard all the time. But I do think that you might have had a master plan of how you saw yourself in the future, like how you wanted to be remembered. But I also have seen things have come up in your life that were very unexpected, and you had to make a course change, and you had to be open to other opportunities. So just working hard every day, but staying open, being aware, staying in touch with the people around you, looking for opportunities, willing to make adjustments.
Yeah. Yeah, go ahead.
I want to get back to Dr. Pullen's presentation.
Oh,
Again, thank you very much for this great presentation. And what do you want to say to?
well, Reid, I'm really proud of you. You know, I've kind of watched your career and you're getting to be one of the old guys. Of course, that makes me ancient. So keep it going. We need more people to keep coming behind us because we need to keep the message alive. And Reid, thanks for being all that for everybody else.
I think your legacy is coming along nicely. Okay, so we're going to have a little fun with our clothes today. We're going to do superlatives, and that's where I ask you about what you think is the best and the worst in endodontics. And these questions are meant to be short answers, so I'll give you a little time at the end to expand on any if you want to. So you ready?
I'm ready.
Okay, so the best article you read in the last year or most interesting topic?
It was easily Nagesh Bola, and he's from the Saibar Institute of Dental Sciences in India, and his article was entitled Cleaning Efficacy of the Smart Light Pro Endo Activator Determined by the Endocator, a Chairside ATP Test and In Vivo Study. That was pretty thrilling. And, well, next.
Okay. Worst article you read in the last year for whatever reason?
Well, you're setting me up for, people to be disappointed, angry, many emails coming in. So I will not mention names or a specific paper, but there's actually been, sadly, a lot of papers that I would say are the worst papers, but I would say over a period of time.
And for what reason in general that you found them bad?
Well, I think it's nice to have a different opinion. I've said that over and over. I don't have a problem if you use a different file to believe something completely different. But when you try to be clever or you're condescending or you don't understand what you're talking about, then I start to see arrogance.
Okay. Most relevant dental journal that you find yourself consulting lately?
Well, I wouldn't say one, but I like best out of all of them, the International Endodontic Journal, IEJ. JOE is okay. I know that's going to crush a lot of you. I don't mean that, but it's not really a clinical booklet to help a clinician get better. And it's gotten over the years really thick and it's very scientific. So it's good though, because I find some stuff there. And then I like, for just a good clinical booklet, it'd be Endodontic Practice United States, EPUS.
Okay. Worst controversy for endodontics?
Well, there's so many, but one would be just the fact that I would say the word triad.
Is the triad dead?
Is the triad dead? And the people that say it's dead, they're all instrumenting. They're all trying to clean with their little gadgets, like my little gadgets. And they're all filling and making white lines. And they're not doing a triad, but they are doing a triad.
Okay. Best controversy for endodontics?
The best one is probably minimally invasive endodontics. And where I would spin that is, okay, we don't have all the solutions. You got these little skinny shapes. I think 1% of the people in the world probably have gentle weight. No, less than 1% on a 5-cent stock. Lasers, very little application in the world, although fabulous. So I would say that it's driving manufacturers and well thought of clinicians to explore the frontier, the future. So out of these skinny shapes, we're going to see the emergence of new technologies.
Okay. Best case you saw in the past year?
Beth Damas, Dr. Beth Damas. Beth showed us how to take young, immature roots and how to be a little patient with vital pulp therapy, get that patient's own pulp to induce root maturation, stimulate those Hertzwigs up the root sheath, get closure, and now we have endodontically strong teeth and more fracture resistance. So Beth, that was a great job.
And let's see here, best new technology of the last couple years.
Well, for me, it's easy. They're still not quite here, but the Endocator would give me a chairside disinfection test. We would love to have that. We could compare your gentle way with this, that, and the other. And then I would say the interview. It's going to be I attended a thrilling meeting last night that I told you about, and it's going to be a big part in the future of diagnostics.
Okay. Most suspect technology of the last few years.
Most suspect. Well, I would say probably the tricalcium silicate family of sealers, because the formulations vary, as we said, from 5 to 50% of what you want. And so because of that, we have a lot of washout. We have a lot of disputes. We don't have international agreement. And I think there's a lot of things we don't know that we don't know. And then because of the skinny shapes, of course, it led to the single cone technique. And I think we can do way better than a single cone.
Okay. Best question you received in the last year.
It wasn't the last year, but it was absolutely the best question I've ever received in my life. It was in Amman, Jordan, and it was ironically from a guy from Beirut, Edmund Koyes. Edmund's a fabulous person, and Edmund posed a question to the tin dentist at dinner, and he said, Cliff, when does endodontics truly begin?
Okay.
That was a Zen question, I think, because of Zen and the surfing and the waves of Reid. I think he would like the Zen part of that.
Okay. And then the last one for you is most misguided dental question you heard in the past year.
Well, the colleague on the AAE forum that was begging manufacturers of the tricalcium silicate cements, sealers, if you prefer, he was begging those colleagues to the manufacturers to get more radiopacity into the formulation, not seemingly understanding that if you add something here, something's got to be straight. You have 100%, got all these little pieces of the recipe that go together, and this guy wants more of this to be shoveled in, not seemingly recognizing he could alter the physical properties that are the most desirable.
Okay. Well, I know I made you be brief, and that's sometimes hard. So is there anything that you want to go back and say a little bit more about, or are you good?
I'm good.
Okay. Well, then that's our show.
There was a worst answer, though.
Oh, okay. Well, that's our show for today. Hope you enjoyed it, and we'll see you next time on the Ruddle Show.